What do you think of NHS funding?
Well, I think we give them too much money already, Rob. I think the problem with the NHS is they're not very efficient at running a business. And if anybody who ran business went in to look at how they do it, you would probably fire half the people in there. They spend way too much money on stuff they shouldn't spend it on. They pay over the odds for medicine, even though they're the only people in the country buying it. They haven't got enough doctors. They've got too many managers, haven't got enough nurses, got too many diversity champions.
Mhm.
And basically, they've got plenty of money. They just don't know what to do with it.
Have you ever thought of running the NHS, Mike Graham?
Well, I mean, I know plenty of doctors who would do a much better job at running it than some of these ludicrous civil servant pen pusher types who've been working from home during the pandemic. Do you know that they've advertised 42 new chief executive jobs just today on average salary of £223,000? And this is to do something which I've never heard of called partnerships of grouping of healthcare. And you just think, what the hell does that even mean? And why are we wasting all this money when we should be giving it to people who need care?
I mean, I have to say, this is a general worry people have that, regardless of your political point of view, I mean, since Bevan formed the NHS, government after government, and it's important to remember this, including Thatcher, have increased spending as a proportion of GDP on the NHS. And yet every government doesn't seem to be able to improve things. In other words, exactly as you say, is it time to have a root and branch look at what I'm going to call the kind of corporate setup of the NHS?
Yes, I think absolutely. I mean, the Blair government somehow sort of stuck us with this private financial initiative, this private partnership, where a lot of national health trusts are now paying money back to people that loaned them money to build hospitals, which is not the business of the NHS. They shouldn't have to do that. What we need to do is introduce people to doctors. I mean, there are people now all over the country who can't get in to see their doctor. Do you know that I had a guy send me a picture on my show outside of his GP surgery? There was a sign that said, "If you are unwell, please do not enter. Go home and call the doctor for an appointment
Right.
on the phone." You're
You know,
going, so we've
mm.
now got doctors who don't want to see anybody who's sick.
Mike, I do wonder, we've never really spoken about this, but I do wonder that, like so many conversations that are difficult, it's really hard for people to have a grown up, mature conversation about this. And it's especially hard for governments. As soon as governments want to talk about new funding models, new ways of restructuring the NHS in order for better delivery, there is this massive kind of public reaction and explosion. We're privatising the NHS. It's almost a form of religion, as if any suggestion of a new look at it is some form of heresy. Do you think that's part of the problem?
I think it's a massive part of the problem. And of course, the left are constantly reminding us that the Tories' end game is to sell off the NHS to Donald Trump and make it all privatised, and all the rich people are going to get rich and all the poor people are going to die in the streets. And of course, the truth is nowhere near that. The point is, it's already partially privatised. We've got dentists that you have to pay for. We've got prescriptions that you have to pay for. We've got points of reference when you have to go and have a scan for something that you have to pay for. So it's already privatised in that sense. And also this idea that it's free at somehow the point of delivery. It's not free because you and I are paying for it. And frankly, I want my money back because I have to go private to do everything. I wanted to get my teeth done. The NHS more or less said they couldn't do it. You should go private.
Well,
I
that
want.
might be your private provider. I mean, you're presumably, I mean, God forbid you had to have ever had a chronic condition. Your private health insurer wouldn't cover you for that, would it?
Well, no, I think the NHS is very good at dealing with emergencies, and I think that's one of the best things that it does. If you're in a car crash, if you have a heart attack when you're out, if something happens that you have to be rushed to hospital, I think they're brilliant. And the people who work in those, very, very high stress arenas are terrific.
Mm-hmm.
But it's as an organisation, it's overburdened with management. There's too many people doing jobs that aren't required, and frankly, they allow doctors who go part time in GP surgeries to make twice the money by doing locum work. Same with nurses. Nurses are leaving hospitals and coming back in as agency workers and getting paid twice as much. It's completely mad.
Mike Graham, shouldn't we be looking across the world, if we were a sensible government, if we were well organised, we would be looking across the world to see who has the best health service, the best outcomes, best health outcomes, access to doctors, and frankly, the best managed cheapest for everybody, but also, and I must emphasize this, where the health outcomes are accessible for all, regardless of your capacity to pay. You know, looking across the world, and you've thought about this, I mean, you've got family in the States, for instance. Where do you think they do it better?
Well, do you know, nobody does it the way we do it. So that must tell you something, right? Nobody has ever copied the NHS in any part of the world. And I think the best way to do it is a mixture of stuff, you know, a mixture of people who have to be given healthcare because they can't afford it, and a mixture of people that can pay for certain things. I think, for example, in France, where doctors are paid depending on how many patients they see, is a much better plan than the one we have, which is you get paid for the number of patients you manage to get onto your role. So you don't actually have to see anybody to make any money. You just have to book loads and loads of people in.
Right. You know, some people look across the pond at America and think, you know, that's not the model we want to follow. They spend more per person on drugs and on individual patients. And, you know, many people, I heard from somebody yesterday talking about a number of people who have made bankrupt in order to pay for their healthcare. You know, as we think about ourselves being a civilized society, that's not something I think most people would advocate for. But you seem to think that perhaps there is an upside to the American system. Am I right?
Yes, absolutely. Well, my mother is 97 years old. She lives in Connecticut. She doesn't really have very much money. She has a teacher's pension. Every now and again, she has to have hospital treatment. She's had a couple of falls. Each time she gets given a very large bill when she goes into Yale Hospital. And each time she says to them, I haven't got that money. I can't pay that bill. And they say, that's fine. Don't worry about it. And it gets picked up by the state. So there is a kind of a safety net, right? So basically.
Can I ask you about that? Is that because, was she a teacher in the States, Mike Graham?
No, she's a teacher here, but she gets her pension paid wherever she ends up living. And, you know, she lives in rented accommodation. If she lived in my sister's house, if she lived on the same household, she would have to, my sister would be liable for the payments. But we're talking 25 grand. When you go into hospital for, you know, my father had Alzheimer's disease. He got taken into hospital a couple of times, and they again would give us a bill for 25,000 and say, we've run loads of tests. And we're like, don't run any tests. We know what's wrong with him. You know, we don't need him to be tested, and we don't need to give you money. But you don't get bankrupted in America just because you can't afford to pay.
There are states where that is the case, Mike Graham.
There is state aid, basically, for people who can't afford it.
For some, but it's...
and I lived there for 10 years. My first child was born in New York City at NYU. That cost me about 10,000 quid because I had to get private health insurance.
We appear to have lost... Oh, sorry. We just lost you there, Mike Graham. Sorry to interrupt you. Mike, we lost you. He appears to have gone. It's called... Oh, Mike, we lost you for a second. You were just telling us about having your first child in a hospital in New York, and it cost you £10,000 when it's free here. I was just, but we didn't get the rest of the story. What happened then?
Well, what I was going to say was I can tell you which was the best care, and the best care by far was in the United States of America. And yes, you have to pay for it, but at the end of the day, you are actually, you know, given a far better service. I mean, most of the my other three children were born here in the UK. And quite frankly, the nurses were quite rude. They didn't really act as if they cared whether anything bad happened to you.
I can't sit back and take this one. You know, Mike Graham, you know, there are some bad stories to be sure about the NHS, but most of the nursing staff who are underpaid and underappreciated do a fantastic job throughout the NHS. And yes, you had 10 grand to pay for the great care that you received, and I'm glad that you did to make sure that the birth of your child was safe. But for millions, and I'm talking tens of millions of Americans, that is totally out of reach and out of the reach of the poorest. I mean, what does that say about whether or not we're an evolved Western, meaningful society of the type of values we would want to share? You wouldn't support that, surely.
No, but the reason I paid that money, Rob, was because I had to have my own private healthcare. Most people in America get private healthcare through their jobs, right? So that's why people go to work, because they get health coverage. I didn't have that because I was self-employed. So 4,000 of that 10,000 amount that I paid out was actually my insurance premium.
Is there room, do you think, for a model which is part private, part public, where, for example, firms make a larger contribution to healthcare, or individuals, that it comes out of their pay packet? In other words, that the private insurers have a greater role?
I think so, and a lot of companies now do that. They offer private healthcare because, quite frankly, unless you are in a critical state, unless you have been in a car crash, it's almost impossible to get a doctor to see you about anything. The NHS is in massive crisis. It's all very well to say, "Oh, the nurses are really nice." It doesn't work. It's no good.
It's difficult because I don't have the statistics at my fingertips, but I have countless examples in my own family of people who have used NHS services where they've been treated for cancer, where they've been treated for a range of conditions, and you know. I look across the world, and I'm aware, speaking to friends in various parts of the world, that the treatment they've received from doctors, from specialists, and having access to that care and not getting a bill at the end of it is not what everybody receives across the world. Um,
No, that's
uh,
true,
uh,
but the cancer outcomes in this country are terrible compared to a lot of other countries.
no, we talk about America. Is there any other country? I don't know. Of our European brothers and sisters that you'd like to give a shout out to?
Well, as I said, I think the French system for the way GP surgeries are run much better. The German system, which appears to be a mixture of private and public, I think seems to be quite efficient and seems to work quite well too. So, I mean, I think there are places we can look at to learn from. And I think that our actual, there's nothing wrong with our doctors. There's nothing wrong with the services they provide when they provide them. They just don't provide them quickly enough. People are waiting long enough and waiting too long to be seen, and it's making the country sicker.
Well, time for a root and branch look at the NHS. You heard it here from the big man himself, talk radio legend, Mike Graham.